Good morning, Patrick here, and again, I've got another question for you. Do you suffer with muscle tightness, stiffness, or soreness? And the reason why I ask this question is so many of my clients that are coming in will regularly mistake what they think is a muscle injury for neurological dysfunction or nerve dysfunction. And let me explain why. When we look at the function of our nerve system, is actually to send signals to every single cell tissue in our body. So what happens to muscles that are in our system if the nerve that is supplying that tissue is interrupted in any way? Now there's going to be one of two things that will happen if you interrupt a nerve to a muscle. If you interrupt a nerve to a muscle, it's either going to do one of two things. It's going to go weak or it's going to go tight. Good morning. And so a lot of people who will have muscle tightness will associate that obviously with excessive use of muscles, tissues, etc. But actually, if you get a nerve to become inflamed or irritated, the chemical process that starts to occur around that nerve actually starts to irritate the way the nerve works and actually increases the chemical process that works inside of the nerve and makes it overfire. And so what we can start to see is most common areas that we'll start to see muscle tension or pain that is replicated by a nerve is around the shoulder blade, around the shoulder girdle, into the top of the shoulder, along the traps and down into the shoulder blade. Some people will feel muscle pains and aches like tendonitis around their elbows. Some can even feel like a cramping in their hands. Other people will get like a band-like feeling in the lower part of the back. Now there are a set of nerves that literally come from the bottom of your rib cage and they extend down to the top of your buttocks. And they're the one that when most people kind of rub across the bottom of their back, they're getting that banding feeling of lower back pain in their lower back. And again, these are all coming from different nerves. Other common ones, into the buttocks and into the top of the hamstring. Again, a lot of people will associate buttock tightness or buttock pain with a tight muscle like the piriformis or the glutes. And a lot of the time, that can be the proximal part or the close part of the sciatic nerve starting to become irritated because again, we've been sitting on our backsides too much and we've been starting to irritate our low backs or the nerve coming as it comes down from the hip. And again, we can start to cause buttock pain. Now, this is my favorite one, which is calf pain. So into your calves. Now, the reason why I know this is my favorite one, because guess what? I suffered with calf tightness on the left-hand side for several years, which I thought was to do with the fact that I'd broken my right ankle until I had another chiropractor x-ray my spine, and we found out that I had a little drop in the L5 disc in my lower back. Now, guess where the L5 nerve root goes to? Yep, you guessed it. It goes down the back of the leg, into your buttock, into your hamstring, and down to your calf. And so for me, for about 3 years, I was getting this calf tightness that just wasn't seeming to go away. Every time I did any exercise in my legs, I used to get this kind of massive pump onto the left-hand side of my leg when my right-hand side felt like it could go on for another hour or so. And again, this was all to do with nerve root irritation. So like I say, if we irritate nerve roots, we can very commonly mistake it for a muscle irritation. Like I say, why? Because a nerve root will do one of two things if it becomes irritated. It will make the muscle go too strong, e.g. it will make it go tight and it will feel sore and tight, or it could go weak. And then you may find that actually the whole leg or the arm or whatever area that nerve is going to actually starts to become unstable and you maybe can't pick stuff like the kettle up anymore, or you can't walk as easily, or you can't squat or get up and in and out of the chair. You actually find it difficult because one leg feels weak. Some people even report their legs may give way. But this may be the reason that if you've been stretching for years and you're not noticing any changes in your flexibility and you're not noticing any changes in that muscle actually feeling any less tight, it's because the muscle probably isn't tight. It's probably to do with the nerve signal that's going to that area, and that's what we need to clear, and that's what we need to find. just some food for thought. So if you know someone's had some muscle stiffness for years and they've been trying to stretch out and they've been doing all these muscle releases, maybe they've gone and seen a massage therapist or a physio and it's just not working, well, like I say, they may have just identified the wrong thing. And it's not to say, by the way, that the muscle doesn't go tight, because it will. If the nerve signal to that area becomes too strong and the chemical process in that nerve is firing too fast and the nerve spasms, the muscle will be tight. But you'll never relax it by stretching the muscle. You need to clear the nerve first. Patrick here from Complete Health. Hope this information was helpful. If you have any questions, leave them in the comments below. I'll be happy to answer some questions. I'm still waiting for you guys to fire me a load of questions. So like I say, leave me some questions behind. Maybe you want me to go through a topic for you guys. And again, just send me a message on the private message and I'll be happy to go through any topics that people want me to discuss. Patrick here from Complete Health, and I'll see you tomorrow.